The R3 Resilient Body membership was designed for patients that knew that health was a priority to them and that they were ready to commit to working consistently with us in order to really better their health over the next 12 months work. It was a way that we could offer consistent care at a lower cost to the patient. So memberships were always something that we wanted to be able to offer. It was just a matter of finding the right way to set them up. So it's really for patients that were going through their plan of care, they finished their plan of care, but maybe they want to continue at a maintenance level. There's an option for that. There's a plan that works well for that, for either one time a month or 2 times a month, or weekly if that's the direction you want to go with it. It's also for patients that maybe they're not hurting at the moment, but they know that they could be and feel better than what they currently are. And so it's a way that they can commit and make that commitment to themselves and to better their health and get that consistent care. There's a lot of good that can be done with consistent care, whether you're hurting or not, and especially the way that we treat here at R3. If you've been here, you know that we are not a traditional physical therapy practice. A lot of our treatments are focused on improving mobility, but also overall improving health. And when you're here receiving treatment from us, you're not receiving treatment just as a knee patient or a back patient, but you are receiving treatment as the person that you walked through our doors as. And so that comes with a lot of factors, and we like to address as many of those factors as we can, and sometimes that involves some of the joint work or the soft tissue work or the nerve work that we do. Sometimes that involves the visceral manipulation work that we do. And a lot of those treatments don't just have an effect on muscles or tissues or joints. They have an effect system-wide. And so we can affect multiple systems of the body. And so we have patients that come because, yes, they feel stiff. Yes, they have maybe some movement issues or some aches or pains, but sometimes it's just they feel better having had the treatments, knowing that their body is going to be able to function more efficiently if it can move better, whether it's at a hip joint, whether it's through the abdomen and the structures that are involved in the abdomen, whether it's some of the ligaments that come off of some of the other organs and affect how we move and how those structures function and ultimately those systems function. And one of the other things I envision for it is it's a great way that if you want just a full body overhaul, if you want work from head to toe, it's a great way to be able to commit to some time to be able to get that done. And while any of the 3 levels would work, I really see the silver and the gold, that middle and that upper level, the 2 times a month and the 4 times a month visits really being the ones that would work well for that. That way we can really work through the foot, really work through the knee and the hip and the pelvis and the lumbar spine and the rib cage and the shoulder girdle and everything that's involved with the shoulder girdle, and really work through the head and the neck and work through all of the factors that would affect those structures. Maybe they don't hurt, maybe there's not an injury, but they know, hey, you know what? I just want somebody to be consistently looking at how am I moving to overhaul my body so I can feel the best that I can feel. So if that's you and you have questions on what this might look like for you or what the different options are, give us a call. We would love to talk to you about what might be the best fit for you.